Well, welcome back to Harmonize Your Life Conversations on Self-Care for Women of Color podcast with your host, Dr. Toni G. Alvarado. I'm so excited to have you with us again this week for another informational and inspirational podcast conversation. We are today going to be continuing our discussion for Women's History Month, talking about women's history, changing the narrative um, for women's history, particularly as it relates to heart health. We had our previous episode, part one of this conversation on heart health. We held with Georgia State Representative Doreen Carter. And so today I'm delighted to have with us in the podcast studio another voice that can help us and teach us and enlighten us on these issues that literally the information that we will receive today, I believe, will change lives and certainly help us to live more healthy and a more harmonious life. So I'll be right back right after this with our guests to continue the conversation, changing the narrative, women's history, and heart health. Be right back. All right. Well, again, I am delighted to have in the podcast studio today a new voice to our podcast. She's not been on with us before, and I recently was introduced to her through our sister and our friend, Georgia State Representative Doreen Carter. Our guest today is Jane Morgan, MD. She is a cardiologist and the executive director of the COVID task force at the Piedmont Healthcare Corporation in Atlanta, Georgia, the largest healthcare system in Georgia. And within this role, she serves as the system COVID vaccine expert, analyzing the science and the data from Piedmont and nationally, drives efforts to addressing vaccine hesitancy via education to internal staff, external stakeholders, media, and the greater external community. Dr. Morgan has been named the Health Equity and COVID Task Force for the governor of the state of Georgia and selected to support the Department of Health in its series of Ask the Experts. Additionally, she serves as a CNN medical expert contributor and is the owner and creator of the Stairwell Chronicles, a social media series directed toward addressing questions surrounding COVID vaccines in a controversial format. Dr. Morgan is published in the areas of congenital heart disease, interventional cardiology, and COVID-19. Moreover, she serves as the chief medical officer of the American Chemistry Council, where she developed a new transitional research program, CEO of 40 Million Beats, LLC, with clients such as Novartis, Abbott, and Moderna, the cardiology advisors to the MitraClip team at Abbott Labs, the worldwide director of the cardiorenal drug development program at Solvay Pharmaceuticals, and the assistant professor of medicine at the Cleveland Clinic. Dr. Morgan currently serves as the president of the Southeast Life Sciences Association, the single largest biotech association in the Southeast. She's an adjunct assistant clinical professor of medicine at the Morehouse School of Medicine. She is the co-chair of the Health and Human Services Conference 2022, board member of the National Diversity and Inclusion Team at the American Heart Association. And I'm sure after hearing just a snippet of her bio, you understand why I wanted her to be a part of this conversation and enlightening us, teaching us, and helping to get the message out concerning heart disease among African American women and families and heart health and what we can do preventatively, correctively, or just to help change the narrative concerning women's history and heart health. Will you help me welcome to the podcast conversation this week, Dr. Jane M. Morgan? Welcome, Dr. Morgan.
Thank you, Dr. Alvarado, for having me.
Thank you for agreeing to be a part of this conversation. As you already know, I was just so taken back by your presentation when I attended the Go Red for Women event with our sister and our friend Doreen Carter. And prior to going to that event, I was actually looking for a African American female cardiologist to come on the podcast to talk to us, having the understanding already, knowing the statistic or the probability of heart disease being the number one disease among Black women and the number one cause of death among Black women and African American families. But you shared so many things with us at that breakfast that I have not been able to really shake some of the things that you shared with us. So first off, thank you again for your work and the work that you are doing with heart health and education training of our community. And if you'll just open up today, just with some, as we get into this conversation, if you would just open up and let us know, why you are passionate. Obviously, as a cardiologist, you're concerned, but you're not just concerned. What I saw in your presentation was passion. I saw compassion and I saw passion for educating and our community regarding heart health. And I just want to know, where does your passion come from?
When COVID began, there was a big scramble at the hospitals. You can imagine. We were caught somewhat flat-footed with regard to the severity and the critical nature of the oncoming of this SARS-CoV-2 virus, this severe acute respiratory syndrome coronavirus 2 that we all know as COVID. And we were unprepared with our supplies, our PPE, right? Our personal protective equipment.
Mm-hmm.
And that was the first surge, Alpha. And then we sort of maybe hoped that would be over. And then came Beta. And then I think with the Delta surge, it was clear to us that the COVID virus, the SARS-CoV-2 virus, was mutating very rapidly. There were going to be a number of variants and what was happening. It probably took us to that third surge, the Delta surge, to really, as a scientific community, have a full understanding of the need for communication of science. Scientists are not in the business of communications. We're in the business of treating patients, of understanding technology, of conducting research. And we generally publish that research amongst ourselves and read it in our language with our lingo. But here we had a COVID surge, we had a COVID pandemic in the middle of the well-established social media age.
Mhm. Mhm.
And the scientific community was unprepared for that. Many scientists are not even on social media. And people who had large platforms
Mhm.
began to step into the gap to communicate science.
Mm.
The majority of these people, and when I say majority, 99.9% had no scientific background. Maybe I would go so far as to say had not even ever taken a science class, maybe.
Mm.
And yet had large followings. People trusted them for whatever they were following them for, and then began to listen to them with their opinions on science.
Mhm.
And we started to see an undermining of the voice of science, the integrity of science. And
Mm.
then there were other people who probably knew better, but intentionally were spreading malfeasance and using it for their personal agenda and ideology. And so I began a series called the Stairwell Chronicles to try to address scientific issues with COVID, specifically
Mhm.
with COVID, such
Okay.
that people could understand them in an understandable way. And so that sort of began my formal communications journey. Now that we are hopefully on the tail end of COVID, we will see the numbers are still going down, but more slowly than I would like to see them, but they are still going down. I transitioned to begin to talk about other issues of importance.
Okay.
Um, One of those issues is health equity, which I think you heard me talk about. The other
Yeah.
issues are women's health issues um,
Mhm.
and cardiology. And so, with my Stairwell Chronicle series, I sit down, I talk about those as well, but I also go out and give speaking engagements. And I think that's what you were in the audience at
Mhm.
an opportunity when I was giving a speaking engagement regarding that.
Yeah. And so it was interesting you said a couple of things that I want to just kind of reiterate. Um, you you are not, as scientists, you're not in the business, or you were not in the business of communication, but because of the miscommunication that we were a lot of the miscommunication that we were receiving, it it really behooved people like yourself to step up and communicate. And what I really like what you said was that you took language that you would normally be speaking to other scientists in
Mhm,
in your scientific language, where
mhm.
you all understood each other, but now um it becomes imperative that you all break that language down into layman's terms, uh,
Right.
so that the public and so that we can understand, because it was very confusing for everybody. I mean, we didn't know what to do. We didn't know if it was spread by touching, it was spread by coughing. I remember, I mean, it was just, I was afraid to go outside for a minute. Is it in the air? Is it, you didn't know. And so
Mhm.
to be able to have people like yourself educating us is so critical.
Right. In my Stairwell Chronicles, I literally sit on the stairs of my house. Those are my stairs. That's actually
Yeah.
my house. Those are my clothes. I'm not in a white coat. And I sort of talk to you as your sister, your friend, your neighbor, your hairdresser, whoever you see, your cousin. Um, and in 60 seconds or less, the videos are just 60 seconds. I take one single question. In the past, it was about COVID. I take one single question, I break it down, answer it in everyday language. I mean, my hashtag is science is for everyone. And I just break it down in 60 seconds and give you something. I don't tell you what to do. I just explain the information such that you can make an informed decision about what's best for you and your family. And as people started to follow, you can really just take a leaf and keep putting leaves on your branch until you sort of flesh out your branch. And then over a time, you have more and more branches. So you start to build a bush, you start to build a tree. And then you can begin to assimilate that information in little sound bites, in easy to understand language. And that's what I began to do. And I started to get a cult following with that. People liked it, they could understand it,
Yeah, yeah.
finally made sense. And I think we saw for a long time the CDC as well. I mean, I spent so much time just explaining what the CDC was saying because the
Yeah, because we it was
CDC.
confusing. One week we're told, you quarantine for 5 days or 10 days, and then 14 days, and then things was changing so rapidly.
things were changing rapidly. The landscape moved rapidly, but sometimes the CDC was actually saying the same thing, but just using different language, which
Okay.
is confusing to the general public. Scientists and and people with medical backgrounds understood that the CDC, in their attempt at clarity, made it even more confusing because it sounded now as if they were saying something different when they were actually saying the same thing, but they had changed the language in hopes of making it clear, and they were only just obfuscating the
Confusing
entire
us more.
situation. So
I
clearly,
get
a great example, the CDC had no experience in communications, had
okay.
never been in a situation where it was imperative for them to have really good communication skills such that
Okay.
people could understand. Their job was really to provide the research and data. The scientists and the physicians utilize that data to apply it to their patient populations and research.
Right.
Um, and then advisories would go out, that sort of thing. And unfortunately, in 3 years, the CDC never really figured it out. I think they hired a communications company that I hope they fired by now because I saw nothing improve. And so I continued to sit on my stairs. A lot of what I was doing was, let me explain what the CDC said today. Um, and and so, but I think people found that very helpful. And now that we're on the tail end,
Mhm.
I still use that format, talk about health equity issues that you heard me talk about, do them in 60-second sound bites. I'll be releasing another series of those in week after next. This week I'm running all heart health, women's heart health issues. Next
Mhm.
week, I'll be talking about health equity. So if you want to follow along, you can follow me on Instagram, on Twitter, even on YouTube at Dr. Jane Morgan, DrJayneMorgan.
Mhm.
Post all of those things, including all of my media interviews as well. So if you follow me, just know I'm talking about science. That's all that I'm talking about. I don't
Okay.
talk politics. I don't talk ideology. I talk things that are germane to science. You follow me to listen to science. And that's something that it took us a long time to understand, the medical community, because
Okay.
people started following people that people started listening to people that they follow for cooking shows and for you know movie stars, and they started getting their science information from these people. I mean, it's the same thing as going to a Russian restaurant and expecting Italian food, but
Yeah.
that's exactly what was happening because I think people didn't have a place to go to hear science. They didn't really even know what to do, so they listened to voices that they trusted, right? Trust
Yeah.
is important.
Mhm. Mhm.
And then unfortunately, they translated one specific area of expertise to another specific area of expertise.
Okay.
Where
Okay.
that person had absolutely no business, was way out of their lane, way out
Right.
of their lane.
Mhm. Mhm.
Um,
Mhm.
but the whole thing, as you said, got confusing. Nobody knew where to go. Nobody knew what to say. Nobody understood what was happening. And the landscape was moving quickly. Variants were developing. And you had a lot of people who intentionally, though, were also obstructing the
Mhm.
voices of science as
Yeah.
well. And
Yeah.
that was complicating things.
People with their own agendas.
Mhm.
So, when you talked about people following and listening to people that they trust, that brings me to another thing that I heard you talk about. We know that in the we have a very love-hate relationship between the African American community and the medical community because a lot of African Americans do not trust the medical community. There's a lot of suspicion around how we're treated and diagnoses and opportunities that we have for for um, for medical care. So, talk to us a little bit about the history of that. Like, expound on. You talked about healthcare equities at the breakfast that I attended. I'm sorry, the brunch that I attended,
Mhm.
and that really really struck a chord in me. So, talk about how these healthcare inequities have impacted us as women of color.
And so not only women, we can talk about women, we can talk about just people of color in general. And I think maybe
Mhm.
I'll start broad and make it narrow, but
Okay.
certainly the Black community has a great deal of valid reason to have
Mhm.
reticence in interacting with the medical community.
Mhm.
A lot of research, and I'm using research in quotation marks. A lot of research has been done to validate, in many ways, the inferiority of the Black race in
Mhm.
the name of research. We have also seen a good deal of medical research that was done without the consent of African Americans, and that
Mhm.
being put forward and people being harmed because of it. And I know everybody's heard of the Tuskegee experiment, so I won't go
Mhm.
through that. You can certainly Google it. And we also recognize that a lot of the medical advances in our society, certainly from yesteryear, were done with the sacrifice of African Americans. So, absolutely, we would have concern with research, concern with clinical trials, and certainly concern with medical centers and physicians. In fact, because of that, um, 80% of Black Americans are seen by Black American physicians.
Yeah.
Uh, no other race really has that large degree of a skew.
Wow.
And that's not by
80%.
happenstance. 80,
80%.
that is not by happenstance. The reason that that happens is that people choose people, just like social media, that they feel that they can trust. And
Mm.
so the first thing that Blacks look for, at least 80%,
I know I do.
necessarily the who has published the most papers and who's done the most search. Who can I first trust to not do any harm to me? I've got to just start there.
Mm.
And so we understand where that is and what that means. And so when I was talking at the brunch, I also was talking about formulas, algorithms, medical equipment that is inherent in the practice of medicine and science that is harmful to Black people that we literally use every day. Again, because of this faulty research and faulty premises. And these types of practices have continued to move forward. And so I gave several examples, and I'm going to go through it now. But if you have any questions, look up my social media, go through my stairwell chronicles. You know that it's the stairwell chronicles because I'm sitting on the stairs.
Yeah.
Look at the topics, and everything I'm about to tell you now, I've gone through in my stairwell chronicles.
Okay. Okay.
Most recent one, so you don't have to scroll back a year, just look the last 2 or 3 weeks.
Okay.
So when we talk about pulse oximetry, so pulse oximetry is when we measure the amount of oxygen in your blood. If you've been to a doctor's office,
Mm.
emergency room, you may have, it's just a little clip that they
Uh-huh.
put on the end of your finger, and
Mm-hmm.
it's tethered to a little machine, and the machine tells you how much oxygen you have.
Mm-hmm.
We now know that those machines can be inaccurate depending on the amount of melanin in your skin, depending on the amount of pigmentation, because the way those machines work is they measure the amount of light that passes through your skin. And what does melanin do? It reflects light, it blocks light. And so what happens is if your oxygen levels are low, the machine could actually read them as normal. Therefore, even though you need medical therapy or you need medical treatment or you need to be admitted to the hospital, you might be discharged because your oxygen levels are normal. Or you might be relegated to wait longer in the emergency room while they triage patients who are more critically ill than you are,
Mm.
when in fact you are also ill and may actually be deteriorating. So not only are you triaged to a lower level of care, you are triaged to a lower level of concern.
Oh my goodness. We are triaged to a lower level of concern and care. Wow.
Mhm.
Based on the melanin in our skin and the fact that
Well,
those machines,
not based on the melanin. The melanin is
because the machine is not
interfering
picking up
with
right.
with the machine, and the machine, which was built in 1974, we first came out with this technology, was not tested on diverse populations, but it is distributed throughout the whole world. The majority of the world is not even white.
Mm, mm,
Very common. The other thing is, as you know, during COVID, 3 years into COVID, to gain admission into a lot of facilities that maybe we had to get into, or
mhm.
hospitals, or your schools, people would check your temperature as you come in
Yeah.
with those forehead thermometers to make certain that you didn't have a fever. Forehead thermometers work in very, very similar technology as the pulse oximeters, reading light, UV light. So the darker your skin, the less accurate this machine will be. If you have a fever, it will miss it. It could miss it. And in fact, a study out of Emory University demonstrated that. And not only that, it further showed that the higher your temperature, the higher your fever, the more inaccurate are the forehead thermometers on people of color, and the
Mm.
more accurate the oral thermometer, the old-fashioned ones you stick in your mouth under your tongue.
Yes, yes, yes.
That is more accurate for the Black population. Obviously, Black people, like many races, come in many different skin tones.
Right, right.
So I want to be clear that we're talking about the amount of melanin in your skin, and that incorporates the majority of people in the world. The majority of the world is not white. And
So,
so,
so let me ask you this. Well, I don't. How do we get around that though? I mean, what do we do?
when we talk about why
Hmm.
this is equipment that has been developed, and physicians, and we could talk about physicians and implicit bias and all of that, but I don't know if we
Hmm.
have time today. So what I'm going to talk about is, we will say that physicians have the best intentions. They are not, or we are not, trained to investigate the development of a piece of equipment. We are trained to use the equipment, to understand the information, to interpret that information, and to apply it to patient care. We're
Mm.
not trained to ask, where did this information come from and how did it get there? So doctors are inadvertently giving guidance to patients, making decisions on patients based on faulty information. They're using the information correctly, but the information itself
No, it's
being
not correct. It
derived
can be incorrect. Hmm.
in a biased way. That's correct.
So, is there anything afoot, a move? Is there a move
Well, I
toward?
hope so. I certainly speak out on it. I haven't been silent. I haven't been silent
Yeah,
about it at all,
we need to take
right? I am
some type of,
pushing.
yeah, we don't have to oh my goodness.
Yeah, I mean,
So as a medical professional though, knowing this, or do most doctors know this, or is this research that's new?
um, I don't know. I'm trying to get a handle on how many doctors know it. We're certainly working to socialize it. I see more and more publications out about it. I certainly speak out about it on social media. I've given grand rounds on it at multiple places. I've spoken at conferences.
I'm going to make
Um,
sure everybody listening to this podcast, we are going to share it,
mhm.
like, share, subscribe, share, and make sure that we get this information out to our communities.
Right. And during COVID, certainly the alpha, beta, and delta surges, which very much were impacting people's lungs, people were intubated. We saw these high death rates certainly
Mhm,
before
mhm,
the vaccines.
mhm,
This a machine called a spirometer, which people may or may not be
mhm,
familiar with, but
mhm,
after
mhm,
you recover from COVID, you're at home, but not just COVID patients, patients with asthma, patients with
mhm,
restricted lung disease. You
mhm,
blow into this machine that you may see at your allergist office, your
mhm,
pulmonologist office,
mhm.
and it measures your lung capacity. How much lung capacity do you have? How much air can you force out of your lungs in a period of time? It measures that. Well, inherent in the software of the machine, so the developers built it this way, they automatically calculate a Black person's lung capacity as being inferior to that of a white person's by 15 to 20%. Therefore, any result that you get from that spirometer that's low, if you were white, you might be treated with a different medication, changed to a different inhaler, referred for more advanced and specialized care. But if you are Black, they will say, oh, that is normal for you. And you can go home where what? You're only going to progress and get worse. That's what I'm talking about, being triaged to not only a lower level of care, but a lower
Level
level
of
of
concern.
concern. We're not concerned. That's normal for you. That started with Thomas Jefferson, President Thomas Jefferson in the 1700s. He, no medical background, let me be clear, but like social media today, had a big platform. He was the president of the United States and he was a big slave owner, right? So he
Yeah.
had a big platform. So he proclaimed in his observations of all of his slaves that they had a 20% lower lung capacity. I don't know how he came up with that. It's just what he said. 100 years later, a physician, a white physician, we're in the 1800s now, also a slave owner, supported that
Mhm.
premise with his quote unquote research.
Mhm.
And then the real shame is 100 years later, we're talking about
It's
now,
still there.
1990,
Mhm.
we
Mhm.
actually had a task force in the United States that upheld that. And after that point is when software developers began to incorporate it into the software of their machinery.
So this is systemic.
This is systemic. You see how things just get pushed along and
Yeah.
then get validated by people and bodies. And so that's where we are with spirometry, incredibly important in managing lung disease, but important in making certain that everybody can get access to the absolute best care as soon as possible when you need it to prevent further deterioration, to improve your health, and on and on and on. I mean, there are many, many. Again, you're welcome to come to my social media pages.
Mhm.
It's literally 60 seconds. I'm taking a long time to explain it here, but on my social media, I'm going to take 60 seconds to tell
Yeah.
you what I just told you, and you can
Mhm.
move on to the next one.
Yeah. Yeah. This information is so, it really, really jarred me when I heard this before when you shared this at the brunch. And I was like, so if you're using your platform,
Mhm.
your social media, Stairwell Chronicles, I'm using my pulpit at the church to educate my congregation and others that listen to us or follow our ministry. I'm using my podcast. But
Well,
what else can we do as a community to bring awareness to these things, and particularly as relates to heart disease and lung diseases and things that are shortening our lifespan as a community, as a people?
yeah.
What else can we do?
Continue to write about it, publish about it, advocate for yourselves. Something that I would like to bring to the attention of your audience, but before we sign off, that's very important,
Mhm.
is kidney disease, which is very pervasive in the Black community for a number of reasons. We have a high rate of high blood pressure, and that's another talk that I give on bias, but we have a high rate of blood pressure, of high blood pressure and obesity. And because of that, we have a high rate of kidney disease, where there's something called the EGFR. Every doctor knows it. We use it on every single patient to determine what your kidney function is. EGFR stands for estimated glomerular filtration rate. Glomeruli are inside the kidney.
Mhm.
Everybody uses it. It is based on a formula called MDRD, Modified Diet and Renal Disease, or uh, CKD epi, chronic kidney disease epi. These are two formulas. Doctors know know the formulas. We had to learn them in medical school, but after medical school, you never use them. Why? Because the pathologist uses them. When you send the blood to the lab, the pathologist does that calculation. EGFR is a calculation. It's not a value that we draw on the blood. They
Okay.
use a number of things and they do this calculation in the lab and then send you back the EGFR. Well, both of those calculations, MDRD and CKD epi, have a race factor in them, a multiplication factor. So, in other words, whatever your value is, if you are African American and it's called AA, African American, that's the multiplication factor, you then multiply that number by a number which artificially increases your EGFR, meaning your kidney function. So it makes your kidney function appear better than it really is. And what does that mean? That means you don't get referred for specialized care by nephrologists. You start medications to protect your kidney late. You go onto kidney transplant list late. Maybe even never get a kidney transplant because you have waited so long. It's taken you so long to be on that list, while your white colleagues have gone onto the list immediately because they didn't have that race factor applied to them. Actually, just this month, the board has taken an unprecedented correction position and have said that every Black person on the kidney transplant list needs to be escalated, and they want to go back and see how long that person was on the list and how long should they have been on the list, and to push people to the front, because now we recognize it's not how long you've been on the list, it's how long you were kept off the list.
Oh, oh, oh my goodness.
And we are now working to correct it. That's just this month, hot off the press. This is only February 14th. That's this month, the last 2 weeks. So you may know something that even doctors don't even know yet.
Wow.
To
Wow.
try to correct for all of the racism that has kept people from getting the kidney transplants that we needed.
We perish for the lack of knowledge, and the knowledge that you are giving and sharing, not just, not just in your Stairwell Chronicles, but in your speeches and coming on podcasts like this. And read in your bio the work that you're doing with CNN and other. You didn't think you were in communications, but you're in communications, and I'm so glad you are in communications, because this is so important. In order for us to change the narrative, we've got to know. And I just believe when we know better, we can do better.
Right.
Being a pastor and a theologian, of course, my work is in Bible and theology. And so I'm preaching and teaching a holistic message, a theology of self-care. And I tell my people, we don't just perish for a lack of knowledge, but we also perish from a lack of action.
Mm-hmm.
So it's not the truth that we know cerebral, but it's the truth that we know through experience and through applying that knowledge to our lives. And so can you just, as we prepare to wrap up, can you talk to us about healthy lifestyle habits that we can take into our own control and maybe so that we don't have to be a statistic in some of these areas, things that we can do preventatively, because I am convinced that and I'm sure you've heard this and probably said it, preventative medicine is always better than corrective medicine or whatever. And so things that we can do on the front end, health wise, lifestyle habits, our relationship with food and exercise, and putting harmful things, toxic things in our bodies, smoking and things like that, and even the health screenings and clinical trials that we may need to be more educated and educated on and participate in.
So I'll talk about maybe just three things that people, maybe don't know. So I'm sort of going to, stick to science. I mean, I think everybody knows to try to eat more vegetables, exercise, take your
Mhm.
medication. So I'm going to talk about a couple of other things. So women go through different stages of our lives during a pregnancy. If during your pregnancy you've ever been told you have something called preeclampsia,
Mm.
eclampsia, pregnancy-induced
Mhm.
hypertension, or even gestational diabetes,
Mhm.
your risk of future heart disease now has been established to be 2 times higher than any woman who does not get any of those diagnoses during her pregnancy. So after delivery of your baby, you must be referred to a cardiologist for care, for preventive management, and for care, because pregnancy is really the first stress test for a woman. This is such a volume overload. And if
Mm.
you developed any of those conditions, you have failed your stress test. And like anybody else who comes to a cardiologist's office and fails their stress test, they're going to be referred on for more highly specialized care. So consider that those diagnoses during pregnancy represent a failed stress test. And if your
Mm.
doctor is unaware, you ask and advocate to be referred to a cardiologist for care.
Okay.
Next thing that I will discuss is another phase in a woman's life, menopause or perimenopause. And
Mhm.
so we know that the number one killer of women in the United States is not breast cancer, it's heart disease. And as you go through menopause, that risk only increases. In fact, it becomes equal to that of men because of the loss of estrogen and
Mhm.
the increase in lipids. We
Mhm.
now know that hormone replacement therapy should be offered to all women. This is estrogen or estrogen and progesterone.
Okay.
The reason it's not offered is that there was research coming out of the 1990s that showed that these hormones are harmful to women
Mm.
during menopause. But
Mm.
as we've gone back to look at those studies, we see that they did not stratify by age.
Mm.
And new studies are showing that if you can start hormone replacement therapy prior to the age of 60, is actually protected against not only your heart, but against cancer as well. So
Okay.
this therapy is not for everybody, but you need to find out if it's for you,
Mm.
because most people can take it. Have this conversation with your doctor. Do not be surprised if your doctor is still unaware. This is very new. I'm in research, right? This is my job to know
Okay.
what's happening. So you may actually have to bring something up, but we're rapidly socializing this information as well. And
Okay.
not only does hormone replacement therapy provide protection for your heart, it also can control all of those symptoms of menopause, hot flashes,
Yeah.
sleepiness. All of
Yeah.
that
Yes.
also helpful. And then the third thing that I will say that people may not think about is dentition. Your
Mm.
teeth.
Yes.
Did you know that the more bacteria you have in your mouth, the more
Mhm.
likely it is to get into the bloodstream and infect your heart and your heart valves, where maybe the only way we can fix that is with surgery to your heart. This is most evident if you're suffering from gingivitis.
Mhm.
You may know you have gingivitis if you have red or swollen gums,
Mhm.
receding gum lines, maybe even bad breath, loose teeth. This is a sign of gingivitis, and you need to see your dentist right away. We also want to encourage you to make certain that you keep up with your dental appointments twice a year at a minimum to keep your teeth clean,
Yeah.
because we now know that's not only important for good
And
oral
change
health,
your toothbrush after you go to your dentist.
not only is it important for good oral health, it's also
Mhm.
important for your heart health.
Your heart health.
So those are the three things that maybe I would review today that you
Okay.
may not hear from someone else. You may not
Okay.
be able to find those.
Okay. So let's real quick. So the first thing is the whole
Pregnancy, if you have
pregnancy,
complications in pregnancy,
pregnancy, menopause, and our dental health.
that's right.
Okay, thank you. Thank you, because you're right. Most things we hear about, the eating and the exercise, but those things we have not heard enough. And I do know I see my dentist, and because years ago I was diagnosed with gingivitis. Now for the last, oh gosh, maybe 10 or 12 years or now or more, I actually see my dentist and my periodontist,
Mm-hmm.
and I see them every 3 months. I'm in one or the other, and it, to continue to make sure I'm clean, my teeth are clean, my gums are clean, and things of that nature. So I go every 3 months. I'm either with my dentist or I'm with back and forth. So I had my dentist, then 3 months later I'm with my periodontist. Then I see my dentist 3 months after her. So I see both of them twice a year, and I'm telling you, it makes a difference.
Right.
It makes a
Right.
huge difference.
And it makes a difference for your heart too. People
Yeah.
don't think about that. So if your teeth and having good oral health is not enough of a motivator for you, think about there's protecting your heart
Is
as well.
protecting your heart. Oh, Dr. Jane, you are a blessing to our community. You are a blessing to women, particularly Black women. And I just want to thank you. I appreciate your willingness to come on this podcast. You didn't know me from Adam's House Cat,
Mhm.
but thank you. I appreciate your spirit and your passion. I started there, and I want to kind of end there in saying how much I appreciate your passion for getting this for your community, for our community, and making sure that we can live long and live healthy
Mhm.
lives. I want to let everyone know where they can find you. Pretty much all of your social media is at Dr. Jane Morgan, correct?
Right. Exactly.
And your
Including TikTok. I'm on TikTok too.
Oh, you're on TikTok too?
I
I
am.
didn't know that.
Yeah.
Okay, so Stairwell Chronicles is .com is her
Mhm.
website. Um,
Right.
you can follow her on Facebook. I have her Facebook there, Jane Middlebrooks Morgan. She's
Mhm.
on Instagram at Dr. Jane Morgan. She's on Twitter at Dr. Jane Morgan. On YouTube, you can go to her YouTube channel. I've been on all of them. I
Mhm.
didn't. I'm gonna now go follow you on TikTok as well, because I'm on TikTok as well.
Right.
And she's also on LinkedIn, Dr. Jane Morgan, MD. And is your handle on Twitter the same, Dr.
Yes,
Jane?
Dr. Jane Morgan.
Dr. Jane
Absolutely.
Morgan.
And
So,
and my and also my webpage is stairwellchronicles.com or drjanemorgan.com.
or
Both those places.
drjanemorgan.com. Dr. Jane Morgan, and she spells Jane for those who are listening. And if you're not on YouTube, go to our YouTube channel, go to my YouTube channel, and subscribe and share. Subscribe and share. Listen, we have to get these messages out. She spells Jane, Jayne, Jayne,
Mhm.
Morgan, Jayne, Morgan. I spell it for those who may be listening to us
Right.
and not on YouTube, seeing your name spelled on the screen. But listen, if you're not on YouTube, I want to encourage you to go to YouTube, subscribe to my YouTube channel, subscribe to Dr. Jane Morgan's YouTube channel. Everybody, a lot of people like to listen to podcasts on Apple and Google and Spotify as you're walking. And we want to encourage you to do that. We're not saying don't do that, but also go and subscribe and share to our YouTube channels. Let me tell you why. Because Google and YouTube are the number one search engine in the world. Google, everybody goes to YouTube. It's YouTube University, right? And so when you go to our YouTube channels and you like and you subscribe and you comment and you share, what happens is you will cause shows like my show, the Harmonize Your Life podcast, Dr. Jane Morgan's YouTube channel, we become higher up in the analytics. So when someone Googles African American women, health, wellness, mental health, heart disease, all those kind of things, Black women, put in any of those hot keywords in Google, and you're on YouTube and you put those in, guess what happens? Our shows come up higher and higher in the analytics, and people don't have to go 15 pages down in those search engines to find us. Help us help you by getting the word out. Like, it doesn't cost you anything to like and subscribe to our YouTube channel. My YouTube channel You can go to my website at drtonyalvarado.com. You can find it there. You can go straight to YouTube, Dr. Toni G. Alvarado. If you're listening, you can also find this podcast on Anchor, Apple, Google, and Spotify. And women, I want you to join the Harmonize Your Life Women's Self-Care Network. We are concerned about health, wellness, fitness, mental health, every aspect of our lives, finances, relationships, recreation, everything that helps us to live healthy, whole, holistic, harmonious lifestyles. And when you become a part of the Harmonize Your Life Women's Self-Care Network by going to my website, you can be a part of this community, and you don't have to do life alone. You don't have to learn these things by yourself. We support one another, we encourage one another, and we hold one another accountable for living healthy lives. Dr. Jane, will you just give us one last word of encouragement as we prepare to leave?
I say, everybody, please take your heart health seriously. Follow me, send questions. I might develop a stairwell chronicle around your question. If you have the question, probably other people do as well. I'm happy to answer it for everyone. Again, if you follow me, I talk science. This past weekend was my birthday, so I threw a little birthday stuff in there. That was a little bit different. But generally, I just talk about science.
Okay, good. Thank you. Thank you. Happy birthday to you as well. Thank you. All right, you all. Thank you for being a part of our March series of the Harmonize Your Life podcast. Women's health. We are changing the narrative, you all, one woman at a time. We are getting the information out there. We're having these conversations that are enlightening and informing and changing lives in our community. Stay with us in the Harmonize Your Life podcast with your host, Dr. Toni G. Alvarado. We'll see you soon.